You're listening to Teens and Ash, the show where two real-life providers get real about health habits, wellness, and the broken healthcare system. We're here to educate, empower, and entertain you. One appointment-free episode at a time. This is healthcare without the bullshit.
Let's rename it Ear Stupid Stuff to like something else.
What have you seen? Show me what you got.
Hills from the emergency room.
Hills from the emergency room. If I can get my eye to put water on, I'm probably going to have to go to the ER for this. I think I need to go be seen. I need an eye stain. I probably got parasites in my eyeball.
Gonocopersyphilitis.
Yes, I touched something on the counter. Okay. Tales from the ER.
Tales from the emergency.
Some stuff we've seen. So, we do see quite a bit of the strangeness. We see people at their worst. We see people who,
we never see people at their best. We'll
never
leave that there.
Well,
could you imagine
unless they need a doctor's note,
having a job, any other job like this, right? Let's say where you are going into a place where you will only take care of humans who either are having the worst day of their lives, think they're having the worst day of their lives, or are so not with it that they don't even know.
They're having the worst day of their lives.
The worst day of their lives. Could you imagine that's your entire population?
And everyone is complaining.
Everyone,
from the moment you walk in the door,
horrible,
to the time you leave. And then when you get home and your family complains about something, you're like,
but any other job, could you, I know retail believes
they complain
that but it's not every patient.
People are happy shopping. I love retail.
A lot of people are happy shoppers. But every single, even in doctors' offices, you might have people that feel poorly, but they are not like they are in the emergency.
No,
it is so different. And even then you say well, this is an emergency room. Well, this is an emergency to me,
to you,
but it's not they enter the emergency room.
Right. So, things that we've seen in the emergency room. So,
what's the number one question you're asked when you say you work in the ER?
What's the worst thing you've seen?
Worst thing you've ever seen?
I don't know. I've blocked a lot of.
I say this: pick a system.
Oh, that's a good one. Pick a system.
Pick a system.
Yeah.
I need to know what you want.
Vagina.
Yeah, exactly.
Okay. What's the worst in that system?
For me?
Yeah. I got one. I got two.
I saw a internal laceration. Very, very, I think I might have seen her soul. I'm not sure. When we were looking, what is that? Oh my.
Is that her bowel coming out?
So that was high up laceration from fisting.
Oh, dear God in heaven.
Wasn't her first time.
Okay. My worst vagina. It's not the worst, but the worst one I had, I was working in trauma, and this girl had been out at Blue Wing. It's very congested right there. She had fallen or jumped off the back of the boat, got caught under the propeller as it was going, and it had filleted her from can to can't.
I've seen a propeller in
God help us, that
but
horrible.
It was axilla.
Oh, God.
Kind of were standing sideways on the boat, and boat went this way, they went this way, and there. That was terrible.
And guy's perspective, I had another trauma guy come in, and he had flown over the handlebars of his motorcycle, and the handlebar had actually grabbed him by the rectum and yanked everything around and forward.
Holy shnikes. I saw a hopper accident where, an industrial hopper, and he was shoving things into it. It was the middle of the night. Foot got stuck.
I've seen a grenade in a hand. That's terrible.
Amputation. Yeah.
Yeah. Okay. Next system.
Eyeball.
Glum.
So it was a bird.
Wasn't there a bird?
Oh, that was I don't know why. I am cursed with eyeballs. It's a known fact. Everyone knows. I'm going to pick it up. It's going to be terrible. And it just is what it is.
Yeah.
It's hilarious. People are like, Tara picked up the eyeball.
But Ashley picked up another cancer patient.
Yeah, another.
Diagnosing. I've had 4.
That was
cancer
one
diagnoses in 24 hours. Yeah. I was like, stop giving me patience.
We don't diagnose cancer in the ER.
No, I'm going to tell you, you got it.
we
And you gotta
say, so there's something there that isn't supposed to be there.
And we need to delve further into this.
And we're like, oh, and we're going to give you referral to oncology, and we're going to give you referral to surge, like a whole bunch of things.
Yeah.
We don't say, hey, I think you have cancer.
That's not our
something
job. That warrants further investigation.
So we found something.
And we're seeing it, and we're like,
this is not supposed to be there. And you got to go see someone to figure out what it's made of.
Yeah.
That's usually my line.
But 4 in 24 hours.
Yes.
2 shifts.
So eyeball. I have so many eyeballs. There's so many. What's your worst eyeball?
I just had a big bad bone globe that was stuck out of his, his eyeball was out
What
of
was
his
the
head.
cause? Beating?
No, I think he just like fell on a corner of a counter and like did this, the corner, and
busted all the horrible.
Someone said, check his retina. I said, are you fucking kidding me? Check his retina with an ultrasound. I mean, we do that for detached retina, but his eye was out.
And you're like, I don't think you understand what I'm explaining to you yet. So
hanging off.
The hole that the eyeball sits in is now behind it. Like
his eyeball is this way.
Here.
Your worst eyeball.
Well, trauma-wise, probably taser wired to the eyeball.
I love it.
And it was cut to hell. And so it's just in the eyeball with small little wire hanging out and, just vitreous just draining down. And he's like blinking and there's a wire in his eyeball. And you're like, I don't know if I can do this. Like, this is terrible.
Ophthalmology.
He just goes to the OR immediately. But my worst eyeball story is the time I accidentally I didn't do it, first off. I had a sublux globe.
Next to.
I had a sublux globe. I had never seen one before. And some people have the ability to put their eyelids behind their eyeball. So the eye's like large marge, like
not human.
And I believe this person had the ability to do that. No. Upper lid behind.
How you
eye. Some people can do it.
I don't want to see it.
There's a genetic thing. It's like I don't know if it's genetic. I don't remember what
in your videos.
It is a whole thing that we call them party tricks.
Yeah, I like party tricks.
But I had never seen it before. Had never seen it. And I was just trying to check a pressure in the eyeball. And so I'm holding the eye like this. And they did have large eyeballs already. Exophthalmist. I didn't go there. I was just there for an eye injury. And I'm checking pressure. I had already paged the ophthalmologist. I'm waiting for him to call. I forgot to check the pressure. Let me run in there and check the pressure. So I'm holding the eyeball. And the patient wasn't the best of patients. He wasn't super compliant.
How old was he?
30-something.
Young enough to know
literally was more angry that he didn't have a hot blanket yet than any of the reasons that he was in the emergency room. And so you're like, hey, I need you to sit up. I need you to sit up. I need you to sit up. Like those kinds of things. Like he didn't want to do anything. I don't know why, I was like, whatever. So we got to check the pressure. I was like, I can't talk to the ophthalmologist without this pressure. So I'm holding the eyeball and I do the same thing so I use this little thing called a tonopin and we touch.
We numb the eyeball and then you
numb the eyeball, touch it very lightly, like
you don't even feel
and it gives us a pressure reading. And I do the same thing. I'm like, okay, so I'm holding the eyeball. Like, look at that little spot over there on the wall.
Don't move.
And I'm like going numb. I'm going towards the eye. And I'm literally like this, like going to the eye. And he's like, slings his head forward like this and is like, my eye. And I'm literally like still in the air.
Where his eye was.
Sir, I didn't touch her. I didn't get pressure.
Look at my eye. My eye is watering as she's talking about.
The patient
killing me.
Sits up. It's like, and this eyeball is not where it's supposed to be.
Where did it go?
It was out.
Why did it do that?
Because it fell out.
Why?
And I was
like, it a fake eye?
No, it was a real eyeball. And I am like 35 sheets of white now. Like,
she came in with a tonopin. My eye
I
right out of my body.
Now, as this had happened, I say he large marged me. If y'all have ever seen Pee-wee's Playhouse, Google it. You'll know it's like large marge. So I'm like, oh my, he's like, my eye. I'm like, oh my God, what is happening here? So I didn't know what to do at that moment. I'm really good at like faking it till I make it. I'm like, sir, give me your hand. I need you to take this part of your hand, put some pressure on your eyeball. I'm going to be right back. I got to grab one thing. I'm like, I got to grab an ear. That's what I got to grab. That's the closest thing to an ophthalmologist I got right now. So I go get the ear doc. I'm like, you come now, right this second. And they're like, oh my God, like in the
Tara's
asking for us. Jesus. And apparently I looked frightened. People are like, I've never seen you look so scared in your life. And I'm like, oh, I was like, we're walking and I was like, listen, I don't know what happened. His eyeball fell out. And the doc's like, what are you? I am known for harassing people and joking with them a lot. So they're like, Tara,
Lies.
is this real? I'm like, listen to me. I was checking your pressure and it fell out. Not on the floor, but it's that way. It's not where it's supposed to be. And he's like, he literally is like,
You're lying.
I'm like,
I'm being punked.
get in there. So I can't even go back in. So I'm so horrified. I don't even know. Like I am traumatized at this point. He walks in, eyeball's fine.
I hate him already.
And the doc like looking back at me and I'm like, still like,
did she hallucinate this?
Shaking. Oh my God. And then he's like, hey man, move your, I don't know. He's like, all right.
What an asshole.
So the patient then, the doc was like,
no, I'm saying the patient.
So then the patient leaves the emergency room AMA, goes to the waiting room and tells everyone out there that the nurse practitioner popped his eyeball out. Luckily, it didn't look like it anymore, but I didn't.
They probably thought it was great.
So fast forward. So I tell the nurses like, hey, cancel my ophthalmology page. Patient doesn't left and doesn't need it anymore.
Did you feel crazy at that point? Like maybe you had hallucinations?
No, I knew what I saw.
Okay.
I knew what I had seen.
I really myself.
I was so shaken. Like I couldn't like get it back together to like go see all the other patients at the point. I'm like, man, I can't pull myself. That was my first patient of the day, by the way. Sets the precedence for the whole day. And so the ophthalmologist then calls, like 2 hours later, calls me, and the nurse comes and gets me from another room and is like, hey, you got to come talk to this ophthalmologist. He wants to talk to you. I'm like, God, prepare for
get my pink slip ready. Fine.
Hooey. Oh my God, it's coming.
Because in the hierarchy of physicians, ophthalmologists are supposed to be like
there's a specialist just like every other specialist.
Well, one ER physician told me the hierarchy of brain power or like their residencies.
Yep. That's probably whatever. So the ophthalmologist gets on the phone and is literally like, hey, what you got going on in there? I'm like, what? He's like, yeah, I hear you have a patient for me. I'm like, I'm so sorry. I asked them to cancel that page. He goes, yeah, just tell me about it anyway. And I'm like, what? I was like, so you want the whole story? You just want to know where it went bad? And he's like, tell me the whole story. I'm like, okay. Blah, 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 blah. I'm doing pressures and poof, eyeball falls out. He's like, laughs. He goes, is it a party trick? I was like, it didn't seem like
I was not having fun.
The patient didn't act like it was a party trick. I feel like this was new information for him too. He's like, he says, nah, he says, that happens sometimes. I said, it has never happened to me. I've never seen an eyeball fall out without blunt force.
Do you think that this cat came into the ER just to have the party trick fun?
No, he had, that was his good eyeball that fell out, by the way.
What was wrong with the other eyeball?
It was a repaired, ruptured globe from the past.
What does he do to himself at the house?
That's what I'm saying. He wasn't like, going to his 9 to 5 after I looked at his eyeball. Like he was not that kind of patient. He wanted a blanket and socks before.
No turkey sandwich?
He didn't ask for that, just socks before I could do the eye exam. It was that
money's worth at that visit.
So anyway, that's what I learned, that this was not an uncommon finding for our ophthalmologists. And he says,
never seen that.
He's like, how'd you get it back in? I said, I made the patient put pressure on it, and I screaming from the room. I said, I'm actually
I
still
cannot see Tara
not well. I'm still,
and my eye is still watering.
And I feel like I am in SVT.
Tara, watch this. I'm kidding.
Oh my God. So if you ever get a chance, look up sublux globes. It's scary. Good stuff. But luckily, so the doc still didn't believe me. Look, go back to the ER doc. He still thinks I'm cuckoo, cuckoo. The next
Tara has gone around the bend.
The next doc comes in and he's like, hey, you ever seen anything like this? Thankfully, that ER doc's like, yeah, it happened to me. He's like, same thing. He's like, I was holding the eye open to do an Pelican. And he goes, and he's like, but I saw it start sliding out and I shut his eye. I shut his eyeball real fast. He's like, push that thing back in there. And he's like, I don't do it anymore after that. So yeah, that's the worst thing I've ever seen about an eyeball. Sorry.
Awesome. I love it.
It's terrible.
I mean,
I'm traumatized.
we've seen things
Same.
cut off.
Everything's cut.
Everything's cut off. I mean, even dislocation.
I've never even.
That's head off the neck.
I have not seen that.
I have seen that.
I've seen it in trauma patients, but
Yeah, car wreck.
not.
Little girl, unrestrained, flies forward into the dash.
In adults. I've seen it in adults, not in children.
It's not in child.
That's terrible. And decapitation, we're not saying like the head came separate.
No,
like, it's still there.
It's internally.
Internal decapitation. Mm-hmm.
Seen it. Potato pessaries.
I've not seen that, but I've heard of them.
So many of you probably don't know. I started out in OBGYN. Everybody's like, ooh, OBGYN, yeah, you get to see vaginas all day. I'm like, they ain't coming to you like a Playboy buddy. They're coming because they got a problem. Same thing in the ER. They're coming because they have a problem, not because they're, so fresh and so clean and all nice and tidy. So back in the day, I guess grandmama told this now grandmama that in order to keep your vagina up, you put a potato.
Vagina.
Your uterus. Yeah, I'm sorry, your uterus, not your vagina.
I mean,
let me get the anatomy
hanging down to your knees.
So, things tend to, go with gravity. Let's go with gravity. And it just tends to fall out. They just become lax. And so things tend to come out. So in order to keep things up, you put pessaries in. So those little things
which are made
for that. But when some people don't have a pessary, they use potato.
Or when their grandparents from the early 1900s tell them pessary.
Right. So you get a lady who comes in, she goes, I got a tree growing out of my vagina. I'm like, well, they do, because the potato has sprouted and it looks like little cauliflower stalks coming out of the vagina.
And I've heard another story about that on a doc who works with, and they called it levers.
Levers,
and couldn't figure, I had she's apparently told him, I have levers coming out down there. Yeah, he was like, I don't even know what's happening here. And sure enough, potato. A lot of people put things in there like it's a little pouch.
Oh, yeah.
Just hold stuff.
Well, then even accidentally, or they leave stuff like tampons, you have to wrap them up twice. You're going to just stick up a room, for a whole day, just because it gets all that flora and that fauna. It turns into, we call it little mouses, because at that point they look like a mouse.
That is the worst.
Yeah, it's the worst. Pine straw in a vagina. You were doing it in the woods on grapes. Yeah. Great. Strawberries are the worst. Don't put those in there. Don't do that. The little seeds, hard to get out.
And then you think it's like blood in some sort of blood, mushy, gumpy
strawberries
blood.
turn purple.
Right. Well, so does some blood. It's like that browny, mushy color.
We've retrieved many a condom. Even like the ring of the condom, we've retrieved those. Those are mine.
Most of the time, the condom is not there.
Most of the time.
By the way, so that pouch, there's an endpoint.
Yeah, it's not a forever ending.
It doesn't just like float into your soul. I mean, it stops. Like you might think that it went further. It did not. It's just in a crevice somewhere.
How long is a average vagina? Like 7 inches. A man standard. I mean, 6 inches. And when women get aroused, it just tends to lengthen up a little bit to take on,
Yeah, I was going to say, I guess it would, wherever your cervix lies, would be your length.
But and as everyone gets older, everything drops. And after children, it drops. Everything gets a little shorter. So, same reason why men still I think it's just the way we're made. Wild stories. I mean, not wild. What? The things that we go, what? I'm sorry, what? I've got one.
Go. I have to think.
Working in triage one day, because that's how it works. You have a provider out in triage so they can stop the timer. So anyway, the scribble girl comes in.
Not anymore.
Yeah, I don't give a shit about time anymore. Well, they do, but they can't fit on the billboard. Stupid billboard. But anyway, you'll see a provider within the first 3 minutes. Yeah, because you saw them in triage for 5 seconds. So this little girl comes in. I want to say it was night shift because I feel like it was our older Rhonda, because she did this look at me. Oh God, what's happening? So anyway, this little girl comes in and she says, I've got terrible abdominal pain. I'm hurting so bad. I'm like, okay, well, how long have you been hurting? Oh, I don't know, just, or something.
This story already has gone 4 different ways in my mind. Okay.
Bad
things that are fixing to be.
So she's telling me, she's like probably 21, 22 years old. She's telling me that her stomach hurts really bad. Any urinary symptoms. Well, yeah, I'm peeing a lot. Okay, maybe you've got a UTI. Yeah, absolutely. Where's it hurting? Just kind of all over UTI. So just so you know, when you need a urine on you, and anybody who bleeds from what, I don't know, 10 to 55, we're going to do a pregnancy test on you just because we have to, just because in case, God forbid, down the road, we need to do a CT of your abdomen, a CAT scan of your abdomen. We need to make sure that you're not pregnant because that's a lot of radiation to a fetus. It's really early. She's like, oh no, I'm not pregnant. I'm like, okay, what do you do for birth control? Well, nothing. Are you sexually active? Well, yeah. But you're not pregnant? Are you sure? She goes, yeah, absolutely. I'm like, okay. How do you know you're not pregnant? She said, because I don't kiss with my mouth open. I said, I'm sorry? She said, yeah, I don't kiss with my mouth open. The only way you can get pregnant is if you kiss with your mouth open. I'm like, while you're having sex?
At least she's pretty.
I'm confused. She said, yeah, if you kiss with your mouth open, you can get pregnant. If you don't kiss with your mouth open, you cannot get pregnant. And I'm like, we send her off to get a urine and it comes back positive for pregnancy. She could not believe it. Her mother lied to her.
I am shocked that the people that she was having intercourse with, when she verbalized those things, they're like, what?
They probably thought she was kidding.
Maybe.
It's so far-fetched. I mean,
wow, that's amazing.
She was pregnant. Yeah. No bleeding or anything. Have you missed a period? No.
I've had a lot of people that are either they don't know they're pregnant or in complete denial of pregnancy.
Or the ones that say they are and they're not.
That is the most stressful scenario.
Yeah.
I mean, those are so stressful to me. Well, and I had one that she was young, she was a teen, and she was coming in with abdominal pain, nausea, vomiting. And she was a bigger girl. You know, she didn't just outright look. Well, one, I didn't see her in triage. I just saw her in the room, and then the staff was like getting IVs, getting things. So I walk in and she's got a gown on and it's hanging down. So it's not like sitting on her or anything. And she is just like, I think I'm going to throw up. So I'm thinking this is all like vomiting type stuff. Yeah. They've already asked her the question, are you pregnant? No. Any chance you're pregnant? No. All those things are pregnancy no's. Initially, right? Of course, we don't believe any of that initially, but I am not thinking we are in active labor.
Yes. Prepare to give a urine when you go to the ER. Do not walk into the ER and pee and then go to triage. Yeah. Wait a minute. We're going to need you pee.
You go to the staff and say, hey, I was going to go to the bathroom. Can I have a cup?
Absolutely.
And carry it with you. Or keep it with you. We have to have urine.
Always.
Urine until proven otherwise.
Absolutely.
We need it.
Just to be connected.
Do it.
We don't know.
Just do
it. Okay. Back to the story.
And then, so she's, I mean, obviously uncomfortable, and she's in E, like right here behind you, right?
Mm-hmm.
And I walk in, and the provider in triage had already ordered all these things. All these things are happening. I can't even get to the patient because there's like a whole IV cart and 2 nurses drawing labs and a student or something. So I'm like, all right, well, she's not dying. I don't feel like she's dying right this second. So I was like, I'll give them, another minute and I'll come back as soon as they get this line taped down. And, ultrasound grabs her before I make it back. And I get a phone call from ultrasound. First of all, I'm not going to lie. Like, I didn't know we had gotten that. Like, the provider had already ordered ultrasound. Like, I didn't know that had happened. And from what they ordered,
because we're looking like torsion or something. Right, could be something like that. And something.
Early pregnancy, miscarriage, stuff like that. No bleeding had happened. So we weren't really thinking that, but maybe ectopic, right?
Maybe.
So the provider in triage had already ordered an early preg-pel ultrasound. So that tells me that even the provider in triage was thinking, if it's anything, it's early. And so I get a call from ultrasound. Hey, I need you to come over here right now. Why? They're like, there's a whole baby in there. There's a human baby. And I'm like, what are you talking about? And they're like, yeah, whole baby. 1, we need to change the order to a limited. And 2, you need to come right now. So I'm like,
do you want to know what it is?
I'm like running over to the ultrasound. As she's laying there, I see her. So her living situation is questionable for that age group. And it was like this whole event. So I have to go get her family member. I'm like, hey, we're going to labor and delivery right now. And everybody's like, what? And I'm like, yeah, we're going to labor and delivery right this second. Call L&D, get everybody ready. And sure enough, we get her to L&D. I mean, I maybe have made it back to the downstairs before the baby would.
Good times.
that happens. I mean, babies born in toilets in the waiting room, all those things.
Oh
but
my God, miscarriages in the toilet. When you feel like you have to have a bowel movement and you were, you know, I don't know, 18, 20, 22 weeks pregnant, you do not get up out of that bed and go to the bathroom. I don't give a shit if you feel like you have to shit. Do not get up out of that bed because you're fixing to pass your baby. Well, if you're taking to stay in the bed, there's a reason. I'm not being a bitch and just like, you can't take a shit right now. I'm not saying that. I'm saying
probably given meds. You don't need to be up and moving.
Please God, don't get up.
These are risks. You're going to fall. Someone's going to fall. Babies are going to fall out of unusual places. It's terrible. Yeah, it's like the apocalypse.
It is. And then as an ER nurse, we have to put the little hat on them and take pictures and dress them up. And we're the ones handling the babies that have passed. And
we don't do that.
We did that
in the ERs that I've worked in.
L&D
does that.
Yeah, they would bring us stuff down, but we would have to do it.
Yeah. There's nothing more. Most ER people
we're not doing it.
Pregnancy, baby, not really pregnancy. We're afraid of babies that are still in the uterus.
Oh my God. When they're like 19 weeks and 6 days and L&D says, we can't take them. They're not 20 weeks. Oh my God. It just makes me crazy insane.
I mean, there's nothing, you will not get moved out of an emergency room
quick enough.
I will wheel you myself.
If you tell me up the stairs in a wheelchair, if that's what it takes.
I'm going to carry you on my back. To the elevator, we're going. 20 weeks and above, don't even tell me there's a delay. We're going to, I'll rent a donkey.
Just tell them you didn't come to
take you up there. Yourself. Whatever has to happen. Yeah. Whatever. I mean, across the board, ear people are afraid of delivering.
We know how to do it. We just don't like it.
It's just not like what we like.
We would rather, I don't know, rongeur a finger.
Crack chests.
God, yeah, drop a tube.
All day, every day.
Yeah.
Intubate non-existent
trachea
airways.
Mm-hmm.
Get your bones out of your pants that are still on the foot out of your shoe. I'd rather do that.
I'd rather get the foot out of your shoe. I've done that a couple times too.
I would rather do almost anything than deliver.
But spider bites.
Oh, spider bites.
Oh, good, Tara.
Oh, go ahead.
Oh, I cannot tell you how many people have come into the ER and said, I've got a spider bite. I've got a spider bite. Whatever.
Every day.
Every day. I think it's a black widow. I think it was a brown recluse. There are symptoms associated with that tell us that it was a brown recluse or a black widow. But for the most part, maybe it was a spider. Did you see the spider? No. But there were spiders everywhere. Okay, maybe it was. Most likely not.
It's not. Probably not.
And the reason why you have a spider bite on your skin is because staph lives everywhere. And that's basically what that little abscess is a staph infection.
Gets in the hair follicle or even a cut you don't even know you have.
Absolutely. Paper cuts are the worst.
Yeah. Like, you know, when you put your hands in hand sanitizer, you're like, oh, wow, I didn't even know I had a cut there. Mm-hmm. That's how easy it is to make an infliction in the skin where bacteria can go. Most people do fine and do not end up with spider bites.
Most people don't. No.
I can probably tell you, I've probably seen 3 spider bites for real. Like black widow or brown recluse. And they had the same presentation, maybe 4 that have in 10 years.
Yeah.
It's very, very few. Everything else is usually a staph-based, localized hair follicle or small wound infection.
I mean, we're probably going to give you antibiotics for that all night.
Yeah.
But I mean, we will. You know, skin is your biggest organ for your protector. If it gets infected and pissed off.
Most of them don't need it.
They don't.
If you're a healthy adult, you really don't need an antibiotic for that. It just has to run its course. And its course can take 7 to 10 days. It just does.
I don't know why that's the magic number. The numbers. 7 to 10 days.
7 to 10 days. Yeah.
Okay.
A lot happens in 7 to 10 days. Your body is a miracle.
I don't like snakes.
Don't bring it. We don't need it.
Or if you bring it, I need it in 2 pieces. I need the head detached from the body if it's fine. I don't care if it's in a Ziploc. I need it in double Ziploc. It better not be moving.
We don't need the snake.
I will create a new door in the back of the ER if you come at me with a snake.
Like, it's really hard to get people to come into your room when there's a snake in there. And that's not what you want to happen if you've been bitten. You want us all to come in the room. But yeah, now, these days, we don't need the snake. We have a basic
What am I going to do with it? And if it's alive, what am I going to do with it? What am I going to do?
Yeah, right. We're going to let it out in the parking lot of the emergency room so we can have more snake bites.
I'm going to call a herpetologist. Come get this thing.
I don't know what.
Joe Pollard, I need you to present to the ER stat.
Ozzy Tears isn't presenting to the ER stat.
Joey will. He used to catch, he had a snake in one hand and a gator in the other down in the middle of Florida. Where's that? You know, he used to play with those things. Oh my God. And then he'll get them in the yard and like, I caught a baby snake. I'm like, wow, it was a baby snake. It's not a baby snake. They're supposed to go around my yard. They know not to come in my yard. But apparently here lately, they've been coming in the house and in the yard.
Yeah.
I almost burnt my house down. It's not long ago. So
yeah, we don't need the snake. Don't bring the snake. Take a picture of it if you want. I mean,
don't take a picture of your poop. Oh my God.
No. I still want.
I don't.
I want a picture of your poop.
I believe you. I don't want a picture.
When you tell me that something is wrong with it, please send me a picture. No, not
You
just
can
on like,
scripted.
not on my days off, but like if you're my patient.
That's what I mean. On your days off,
No,
people will send me.
I don't want pictures of your poop on my days off. If I'm talking to you about your poop and you happen to have a picture, yes, I want to see it.
Sure. Okay. Blood and poop.
Blood and poop.
Bright red blood. Probably okay.
It's probably benign.
And when you put blood in water, it looks like way more than what it is. Maybe a couple of drops and just make the whole damn bowl. How else you know this?
Just blood and poop is.
Why is that so alarming?
It is alarming. After all these years, I mean, it's alarming to me. Like, I'm going to bird dog that.
Absolutely. If it's black, you in trouble.
I mean, but in the emergency room, I'm really looking for like an active GI bleed,
Absolutely.
a dropped H&H,
Mm-hmm.
and other
If they look
things that
pale
are
in their
going
lips and
with
their
it.
eyes, oh my God, their H&H is down.
So blood and poop is a whole thing for me to an extent. Now, if you're 20 years old and, you know, it's like, it was just when I wiped
one time on the tissue.
I just noticed
streak.
it today. I think you're going to survive this. Now, if it continues to happen, but you know, a lot of people present to the ER for that.
Yeah.
I wiped this morning and there was blood. There was a whole line of blood. My favorite part is when it's a young female and they don't know if it's vaginal or rectal. And then I get to figure that out.
Yeah.
Or urinary. Yeah. That's my favorite, is figuring
We got
out where
3
it's coming
holes
from.
we're gonna check.
Let's play how many holes do girls have?
Yeah.
3. The answer
There's more than that. I'm just telling you.
it's not just 2.
Okay. What else?
I don't have to have that conversation as much anymore. I think the internet, I think people are maybe educating themselves a little bit.
Yeah, and the pregnancy test in the ER, that's just not going to happen.
less.
It is a
Yeah.
lot less. Absolutely. I feel it because we were it's just about go to the dollar store and get a pregnancy test.
So by the way, the tests that we use are cheaper than the Dollar Tree's test because most hospitals are the lowest bidder, right? And we use the dipsticks, like
You get a better one at the dollar store.
probably going to get an easier one to read at the dollar store than what the hospital is using. So it's the actual same thing. You're just going to pay like 15 times as much.
$15 million. I'm kidding.
$1 million. So now if you have positive pregnancy
to talk
and
about something
pain, that's different. But just wanting a pregnancy test, like there are so many other ways to do that. And plus you're going to lose like 4 hours of your life.
Yeah, for what?
Waiting for that.
Congratulations.
We're not
I mean,
gonna
them come in and ask
prioritize.
for a pregnancy test, and I'm not doing it. I'll tell them, I'm sorry, you had a positive pregnancy test. Yeah, I had 3 of them. Congratulations, you're pregnant. I'm not going to do another one. I'm not going to get a false positive. You just don't. You may get a false negative, but you're not going to get a false positive. Okay, here's something else we're going to talk about in Florida, which we saw probably 5-6 years ago, a huge surge of it. I don't know if y'all are still seeing it now. Cannabinoidal hyperemesis.
Yeah. We see it a lot.
Still seeing it. So, Florida has the, we're allowed to smoke weed and stuff now. You have little cards and everything, which is great. I mean, I do believe that there's a place for that, but I mean, not just recreational. You can just, whatever. Anyway, whatever you want to do. I don't care. But just don't come into the ER. And when I tell you that your marijuana is making you vomit from your toes, don't tell me I'm wrong because you take the marijuana, you use the marijuana for your nausea. Well, guess what? It happens. There's even an article in High Times that talks about cannabinoids. Basically, we'll ask a series of questions for some nauseated people. And a lot of times people will come in and you could smell marijuana on them. It's fine. But
Yeah,
we'll
we're not
ask them.
judging.
We're not judging. We're just trying to figure out how to take care of
So
you.
we don't have to do a test that
We got
tells
a
us.
CT scan, which exposes you to radiation.
A
It's
drug
not easier.
screen. Like, just tell me.
Tell me. I
and
don't
then
give
I
a shit
can
what you do.
Document it. And then we don't have.
We've
I'm
all done
saving-
our own things. In the
I'm
past.
saving you a CT, saving you a drug screen.
So if you come in and we ask you things like, does anything make it better? You say, yes. Getting in a hot shower makes it so much better. That's key.
That is the.
We used to have a lady that came in to the ER and she would somehow get towels and she would block the bottom of the door in the lobby bathroom. There were 2 lobby bathrooms. She'd block the door. She would take towels and stuff it over, drains in like public bathrooms. Yeah, right. She'd do that. And then she would turn on the hot water in the bathroom and lay down in the bathroom hot water because I swear to Jesus, she did it, I don't know, 3, 4, 5 times. I'm like, can you please lock the door? And we couldn't get into her because she's busy laying down in hot water and she wants us to help her stop throwing up. So she would smoke more. I'm like, that's not helping. That's actually making it worse. So when we tell you, we're not being assholes because we're judging you because we think that you smoking weed is wrong. I want you to smoke the weed if you need it. Absolutely. I want you to do it. If you're using it, absolutely. For even recreationally, I don't give a shit. Just don't overdo it. Because when you overdo it, you're going to throw up from your toes.
Or just tell us.
Just tell us. I don't care.
It's super helpful.
God. Spend so much time and energy.
Right. Because when you see those people vomiting and they are adamant that
I feel terrible for you.
Well, especially when you don't know. Like those few that you're like, wait, what's happening here?
Mm-hmm.
And you don't know that it's, there's a marijuana component.
There's so much stuff that come out of their mouth.
Yeah. And you're like, geez. And then normal Zofran's not working. Then
then it'll make it worse.
You add a UDS and you're like, oh, never mind. I'm like, okay.
I'm writing down this $40 million workup and now I've got a $2 workup.
Yeah, I can help you now because
just be forthcoming with it. We're absolutely going to help you. Just tell us. And it even happens in the primary setting too. People come in, they've been throwing up for days. I'm like, well, how much marijuana are you smoking?
And I'm going to say that's a real emergency.
Yeah, because
they are going to be.
You're going to electrolytically imbalance yourself.
Balanced, quick, fast, and in a hurry. It's that impressive amount of vomiting. That's what
It's impressive.
It is impressive.
I think it's even worse than chemo vomiting.
I agree.
Yeah.
It's just so acute and so bad and so fast.
It's the retching for me.
Yeah.
That.
I know, it doesn't bother me.
No, it's just constant.
Oh,
you're like,
having to
just not do that.
They're like right here. And you're like, patient presents the emergency room with depression and you're like,
every other word
in between the retching.
I want it to stop too, not just you.
It's violent. Oh, yeah, that's a good one. That's a good one.
I just wish people be forthcoming. Just tell us.
Really about anything.
We're not mind readers, believe it or not.
And most of the time it doesn't change anything, but in a negative manner, it always is helpful for you and me because I probably am thinking the worst of the worst and then trying to take myself off the ledge.
That's how we do an ER. We go to the absolute worst things. We run it back and then, okay, it's not the worst of the worst. We've ruled all those things out. So now it's just this.
Right. This is
this little thing.
Doable.
That's, easily remedied. In an office setting, it's kind of the other way.
Right.
You start out with the easiest and go to the worst.
Right. People are like, well, I just go see my doctor and then, sure. Well, I don't want to go anymore. So there's a different type of human. Yeah. 2 different type of humans. Those are like the farmers.
So God in heaven.
They'll go to the doctor.
I asked our medical director one time why we don't have a freestanding out here where we live. Because those people don't go to the ER, Ashley. I'm like, oh, realistically. And I worked over in J too. That's really farming. So if a farmer comes in, that's a big, oh shit, everybody hands on deck.
Their problem is usually significant.
If they finish their day, it's probably not going to be as bad as if they didn't finish their day. Well, if their wife told them to come in, you better call. Just call. Oh,
get the crash cart. Just get the crash cart. Yeah. Or if they come in at the end of the day, they've already amputated something.
Oh God!
But they had to finish what they were doing. So just get ortho on board.
Yeah. Like call somebody immediately. And they're really calm, cool, and collected, which is really weird. I ain't never seen a more calmer person than a farmer
or an elderly woman that is 30s, 40s, things of that nature.
What else?
I don't know what you got on your paper.
Oh my God, so much. CPR. You want to talk about CPR?
CPR. Yeah.
CPR is awful. If you are elderly,
if you're wonderful,
when you're young and you have age on your side, CPR is fabulous.
Watch.
It's awful to watch. If you have comorbidities, if you have had a just a life-altering diagnosis, if you've come in with something major, your system wrong, I can't even think, heart attack, stroke, like brainstem stroke, and we're doing CPR, we're basically just trying to keep you alive.
We don't know that's happening.
We don't. We're going to do it till the cows come home. So we either have no ventricular activity or
your family tells us to stop.
Yeah.
Do not resuscitate is presented.
A Lucas. Can we just talk about that?
I like a Lucas.
I hate a Lucas. Y'all
Lucas.
seen them.
Lucas is the new, it's relatively new device.
It's great to use, but I hate looking at them. It's like, oh God.
For CPR, and it's very effective.
So they have this machine, this little thumper, and they strap your dead, because you're dead at that point. If you're getting CPR, you're pretty much dead. So they strap your dead hands to the top of it. They Velcro them down, and this thumper just goes, so you're basically CPR on yourself, but it's so aggressive.
And it's good CPR.
It's really good CPR. You're going to have good blood flow with it. Oh God.
I can imagine if you survive that, how bad.
Oh my God. Can you imagine?
Yeah. I'm sure there are like instances. I'd like to read some of that. People that have survived CPR, and I'm sure they're super thankful for it, but
yeah.
There's a,
I'm not saying CPR is ineffective. I'm saying it is effective when done correctly. And when you have age on your side, no comorbidities. I mean, if you're 90 something years old,
CPR, yeah.
We're going to break every rib. All the cartilage is going to tear.
I hope my family doesn't do that to me when I'm in
I will get up and punch them in the face.
Yeah. I mean, of course, I haven't been in that situation, so I'm speaking, as a not 80 and 90-year-old. There are some people that I guess are just want to live forever, afraid of dying.
None of us is getting out of here alive, y'all. Not one of us. The only certainty in life is death.
Taxes. Death and death.
Now I'm going to start retching.
But I think that the Gen Pop should do CPR classes. I think it's very, very, very good for everybody to have, because included in CPR classes, BLS, is choking. Choking is something that every one of us are going to encounter in our lives. I really feel like either you're in a restaurant where it's happening, or it's happening to a family member or a friend or something of that nature. So I think that BLS for the population is super helpful. Because when the situation occurs, you might not remember everything,
but you're doing something.
But the little steps you do remember helps us when they make it to us.
Yeah, absolutely. The quicker you get it started, the better outcome you're going to have.
And we are not doing airways anymore. That is not our number one thing.
That's wild to me.
I know it was airway for a long time.
But it's wild.
All CPR.
Just based. CPR, no breathing.
So if you don't know anything else, just do CPR.
Get on the chest and keep going. And if you're somewhere like in a public place, a lot of places have AEDs. We have an AED here. So you're doing CPR, you put the AED on, you continue CPR. When the AED says off the chest, you're off the chest. As soon as it says what the rhythm is, you get right back on the chest. You never stop. Even if you get a rhythm back, you're going to have a weak rhythm. Get back on there. Get to pumping.
Call 911, restart all this.
Absolutely. Call 911.
Put them on speaker, put them on the ground.
Hard surface.
Well, sometimes that's not, they're not.
We're not doing CPR on a bed.
Not everybody can drag them out. Concludes the Teets and Ash show today.
We'll see y'all soon.
See you later. Bye.
You're listening to Teets and Ash, the show where two real-life providers get real about health habits, wellness, and the broken healthcare system. We're here to educate, empower, and entertain you. One appointment-free episode at a time. This is healthcare without the bullshit.